Talk about your medical school schedule versus undergrad schedule. How did each year differ in medical school? Okay, so my undergrad schedule was actually pretty packed because I did a year and a half of kinesiology, and then I switched halfway through my second year to a chemistry and biology double major. And along with that came a lot of labs. And because I knew I wanted to do medicine, that also came with a lot of extracurriculars. And that really swamped me. I was super busy at Acadia. And that's actually, I thrived off that for quite a while, but then, your human body can only take so much. And I ended up really spreading myself too thin and got, I would say, borderline burnout from in my fourth year at Acadia, trying to do way too much and put my all into everything, which just wasn't realistic. So I had to step back from a few things and put more time into other things, and that ended up working out well for me in the end. In terms of medical school, because I was so heavily involved at Acadia and my schedule was quite busy, it didn't really seem like much of a difference in the initial transition. The biggest difference for me was that you can't know everything. There's just too much information that's thrown at you about every different system in the body, and it's impossible to know every little detail and to memorize every word on every slide, unlike you might have been able to do at Acadia or in your undergrad classes. There's so many opportunities to get involved. I know there's like clubs and stuff at Acadia. They're called interest groups in medical school at Dal. There's anything from the nutrition in medicine to exercise in medicine to the surgery interest group to the family medicine interest group. I think there's now a LGBTQ in medicine interest group. Anything you can really think of. There's probably someone who has thought of an interest group or will be starting an interest group. And you just have to apply for funding for it. I started a few interest groups myself, and I was really involved in student health and wellness. So that was like my big primary involvement was with health and wellness, and that kept me definitely busy enough. I was smart enough to take what I learned from my fourth year and not get too involved, because I knew that the workload would just keep piling up and piling up. And you do have lectures pretty well every day from just core material that you're learning about different body systems. You also have lectures about professionalism and ethics once a week. And then you have small group sessions related to what you're learning in your class and small group sessions related to what you're learning in your ethics courses. And then you have all your hands-on sessions, which are multiple times a week. And then you have your lab sessions where you go into the anatomy lab and learn on the cadavers, which are actual human bodies, and they donated their bodies to Dalhousie's medical students to learn on. So there's a lot, and the schedule definitely gets busy. You have to find time to complete your they're called tutorials. They're these cases that you have to go through in all of your small group sessions. You have to find time to complete those before the actual day of your group session. So what I did is I usually set aside an evening, whether it was Friday or Saturday evening, to really hammer. Just dropped my laptop charger. I just used like a Friday or Saturday evening to prep for those, get all those done, and also to make my study notes from the week. So that took up a decent amount of time. The other evening that I wasn't, so if I was doing all that work on a Friday evening, the Saturday evening would be the time where I would go out and hang out with friends and have some fun, because you only need to blow off some steam when you're in med school. And then I also got really involved in intramural sports as well, a lot of which are on the weekends, but many evenings throughout the week as well. So if I had a game or a match or something on a day throughout the week, then I would just postpone my studying or my note taking until the next evening or that weekend. So it is busy. It's definitely busy. So that's your first 2 years. And then you get into your clinical work where you're in the hospital every day. And that can be pretty brutal too, because you can get really long days, especially on some of the surgical specialties where you would be starting at 6 a.m. or earlier, seeing patients in the morning, ones that have had operations on them or ones that were super sick and needed to be admitted into the hospital. So you do that, and then you would go to your clinic for the day or to the operating room for the day. And then afterwards, you might be on call for that whole evening, and you're fielding calls from nurses and other physicians, and need to be prepared to go in if there's any emergencies. Sometimes you just stay in the hospital because the service that you're on, you basically are guaranteed to get a call, or you go home, and if you get called, you have to come back in. So those can be really busy. In your third year, you're rotating through pretty much every different specialty, obstetrics, pediatrics, family medicine, psychiatry, a bunch of different surgical specialties. Most of the things that you can think of, you'd end up going through. And then in fourth year, when you're trying to figure out, or you already know what you want to do for the rest of your life, what specialty you're interested in, you do electives. And typically you do them across the country at different schools and different programs that you might be interested in doing your residency training at. But obviously with COVID, there was a lot of travel restrictions. So my cohort was restricted to initially the Maritimes. And then when cases started getting worse, we then got restricted to just Nova Scotia to do all of our electives, which can be tough if you really wanted to go to Ottawa for your training, or if you wanted to go out west because you heard they had a really cool family medicine program out there where you can be a doctor in the mountains and go skiing all the time. So that made it difficult, but in the end, I matched what I wanted to, where I wanted to. But that'll be changing for sure once things settle down with COVID and vaccine rates are up and traveling is open again. Students will be allowed to go to different schools to do their electives. And then you have a whole interview process after your electives, which again, typically you fly back out to the schools that you might have done your electives at if they give you an interview, but those were all virtual this year. And I think they're going to keep them virtual for the foreseeable future because it is kind of a pain in the butt having to spend a ton of extra money to go fly to schools that you had already been to just for a 20-minute interview. And they schedule them all the interviews within a 2-week period typically. So you could be having an interview at Vancouver, and then the next day you have an interview in Montreal, then the next day you have an interview in Saskatchewan, and the next day you're back to Halifax, and then the next day you're back out to Alberta, going to Calgary for an interview or something. It's crazy, especially if you're interviewing for multiple different specialties. They really won't coordinate their interview schedules. So you might even have to turn some down. But it's fun. It's a lot of fun. I did really enjoy my whole 4 years. You make a lot of really, really close friends because you go through a lot of stuff together. Some mutual suffering, but also a lot of really, really fun and exciting times. Lots of things you can get involved in, like med games, and Dalhousie does an annual theater performance, but it's also a fundraiser, and every class competes against the other classes to put on the best show. And then, you just make tons of friends and end up doing really fun weekend trips or longer trips with them. And those are friends that I'll have for the rest of my life for sure.